Hello everyone, welcome once again to Center for Liver and Digestive Surgery, Visakhapatnam. Today in HPB surgery, let us discuss something about Whipples procedure. Before going to the details of Whipples procedure, let me explain you the anatomy and function that happens in that particular region. So this is the upper digestive tract, this is the food pipe, this is the stomach, this is the liver. The bile ducts come from the liver, the gallbladder joins the bile ducts here, and the bile duct joins the pancreatic duct here. This is the pancreas, which is responsible for secreting the digestive enzymes as well as insulin. Bile ducts, they release the bile juice for digestion of fats. Once the food enters here, the bile juice and pancreatic juice enter this part of the duodenum and they help us in the digestive process. So what is Whipples procedure? Who needs a Whipples procedure? Patients who have tumors in the region of the ampulla. This is called the ampulla. The opening of the bile duct and the pancreatic duct into the intestine is called as the ampulla. So any patient who have tumors close to the ampulla, they can be ampulla per se, or they can be in the distal bile duct, or they can be in the duodenum, or they can be in the pancreatic head. So all these patients, removing that particular cancer without removing the adjacent organs is a difficult procedure and it is not possible anatomically. So they involve removing this entire tissue as a block, and that procedure is called as a Whipples procedure. So in this procedure, we remove the bile duct, we remove the gallbladder, we remove the duodenum and the distal part of the stomach, we remove the head of the pancreas and a part of the small intestine called jejunum. So this removes a block of tissue like this. So this entire tissue is removed as a single block, and this procedure usually takes 4 to 5 hours on an average, with an average blood loss of 300 to 500 ml. So far in the Whipples procedure, I have discussed what we are going to remove. We have discussed the resection part. Once you have removed some parts, you have to reconstruct. Now let me discuss something about the reconstruction part. So after the resection, we lose this part of the gastrointestinal and hepatobiliary system. So now what we are left with is the bile duct, which is divided here. So you are left with the bile duct here, which is in continuity with the liver. Then you have the stomach. After dividing the duodenum and the pylorus, you have the stomach left here and the pancreas. So now our aim is to restore the continuity of this digestive system with the intestine to facilitate our digestive process. So now once the intestine is cut here, the remaining part of the intestine is brought and it is anastomosed or joined. It is joined first to the pancreas, which we call it as a pancreaticojejunostomy, or sometimes we also put this stump of the pancreas into the stomach, where we call it as a pancreaticogastrostomy. Then we take this loop of intestine and join it to the bile duct so that the bile juice also comes like this. The pancreatic juice comes like this. This is the closed end of the intestine. Then we take a loop of the small intestine and join it to the stomach. So this is what is called as reconstruction after a Whipples procedure. So the pancreatic juices enter this way, the food enters this way into the stomach, the bile juice, all these mix into the small intestine, and further digestion takes place in the small intestine. So what are the complications related to Whipples procedure? So having so many places of joints, we have joined the pancreas here, we have joined the stomach here, We have joined the bile duct here. Any joint is subjected to stress. When they are subjected to stress, there can be a leak from that particular region. There can be a leak from the stomach, there can be a leak from the pancreas, there can be a leak from the bile duct, and these can accumulate as collections inside the abdomen and cause fevers or abscesses. But to drain these collections, we usually put some drains in the abdomen and come out. But most of 90% of the cases, they heal well. In 10 to 15% of the patients, we experience these leaks. So if these leaks occur, they are going to prolong the patient's hospital stay. 95 out of 100 operations, patients go out safely without any problems. But 5% of them do land in some sort of problems, usually a life-threatening problem. So they can be having a fistula from the pancreas, they can be having fistula from the bile duct or from the intestine, which can be life-threatening.